This one should hopefully make your life a little bit easier. So if you are the primary carer or the next of kin for a relative, so that could be a parent, it could be a grandparent, and they are getting a bit older, they are getting a bit more frail, and you're worried about them, and you are trying to take a bit more of a leading role with their healthcare, it's a really good idea to get your relative, so the patient, to write a letter to their GP saying that they give consent for you or your brother or your daughter or whoever to have access to all of their health records. Obviously, only if they consent to this. Because what that means is that when you call up about your relative, it means that we can then speak with you freely. If we don't have that documented written consent from the patient, then we wouldn't be able to speak with you and discuss anything to do with their health. So this is different to an LPA. The LPA stands for Lasting Power of Attorney. If you have an LPA, you can get it for health and welfare or for finances. Now, obviously the finance one doesn't really apply to anything to do with healthcare, but if you've got LPA for an older relative, the Lasting Power of Attorney only kicks in when the patient is incapacitated, if they lose their mental capacity, if they are no longer competent to be able to make decisions about their own healthcare. That is different to you having consent to discuss their medical records or the patient's medical records whilst they are still able to have conversations themselves.